trauma and trust issues. Strategies for rebuilding trust in relationships. Trust is a fundamental component of healthy relationships, but trauma can severely impact one's ability to trust others. Trauma survivors often face significant challenges in building and maintaining trust in both personal and professional relationships. This video explores the challenges trauma survivors face in building and maintaining trust, and provides strategies for rebuilding trust in relationships. The impact of trauma on trust. Betrayal and broken trust. Trauma often involves experiences of betrayal and broken trust, whether from abuse, neglect, or other traumatic events. These experiences can leave lasting scars and make it difficult for survivors to trust others again. The pain of betrayal can create deep-seated fears and insecurities, making trust a challenging issue. Hypervigilance and fear. Trauma survivors may become hypervigilant, constantly on the lookout for potential threats or signs of betrayal. This heightened state of alertness can make it challenging to relax and trust others, leading to strained relationships. Hypervigilance can cause individuals to overreact to perceived threats and misunderstand intentions. Difficulty with vulnerability. Trust requires vulnerability, but trauma survivors may find it challenging to open up and be vulnerable due to fear of being hurt again. This difficulty can create barriers to forming deep and meaningful connections. The fear of vulnerability can lead to emotional withdrawal and isolation. Challenges in building and maintaining trust. Trust in personal relationships. In personal relationships, trauma survivors may struggle to trust their partners, friends, or family members. They may fear betrayal, abandonment, or rejection, leading to insecurity and tension in relationships. Trust issues can manifest as jealousy, clinginess, or emotional detachment. Trust in professional relationships. In professional settings, trauma survivors may find it difficult to trust colleagues, supervisors, or clients. They may worry about being judged, criticized, or taken advantage of, impacting their ability to collaborate and work effectively. Trust issues can hinder career growth and job satisfaction. Self-trust. Trauma can also undermine self-trust. Survivors may doubt their own judgment, intuition, and abilities, leading to a lack of confidence and self-esteem. Rebuilding self-trust is essential for overall recovery and well-being. Strategies for rebuilding trust. Therapy and counseling. Therapy can provide a safe space for trauma survivors to explore their trust issues and work on rebuilding trust. Therapists can help individuals process past betrayals, develop healthier perspectives, and build trust in a supportive environment. Therapy can also provide tools for managing anxiety and fear related to trust. Mindfulness and self-awareness. Practicing mindfulness and self-awareness can help trauma survivors become more attuned to their emotions and reactions. By recognizing and addressing feelings of fear and mistrust, individuals can begin to challenge negative thought patterns and build trust. Mindfulness practices can reduce anxiety and promote emotional balance. Gradual exposure. Rebuilding trust takes time and patience. Trauma survivors can start by gradually exposing themselves to situations that require trust, beginning with small steps and gradually increasing the level of trust required. This gradual approach can help build confidence and reduce anxiety. Small successes can reinforce trust-building efforts. Setting boundaries. Establishing clear boundaries is crucial for rebuilding trust. Trauma survivors should communicate their needs and limits to others, ensuring that their boundaries are respected. Clear boundaries can create a sense of safety and security in relationships. Respecting others' boundaries is equally important for building mutual trust. Open communication. Open and honest communication is essential for building and maintaining trust. Trauma survivors should strive to communicate their feelings, needs, and concerns openly with others. This transparency can foster understanding and strengthen relationships. Effective communication can prevent misunderstandings and build connection. Building self-trust. Rebuilding self-trust is a crucial aspect of healing. Trauma survivors can practice self-compassion, set realistic goals, and celebrate their achievements. Developing self-trust can enhance confidence and empower individuals to trust others. Self-trust can provide a foundation for trusting relationships with others. Case studies. Case studies illustrate the experiences of trauma survivors and the process of rebuilding trust. One case involves a trauma survivor who struggled with trust issues in romantic relationships. Through therapy and gradual exposure, they were able to build trust and form a stable, supportive partnership. Another case highlights an individual who faced trust challenges in their professional life. By practicing mindfulness and setting clear boundaries, they improved their relationships with colleagues and gained confidence in their abilities. Trust issues are common among trauma survivors, impacting personal and professional relationships. Understanding the challenges in building and maintaining trust and implementing strategies for rebuilding trust can support trauma recovery. By seeking therapy, practicing mindfulness, gradually exposing oneself to trust-building situations, setting boundaries, communicating openly, and building self-trust, trauma survivors can rebuild trust and foster healthier relationships. Recognizing the impact of trauma on trust is the first step towards healing and establishing meaningful connections. Building trust requires patience, commitment, and the willingness to engage in self-reflection and growth.